Seizures are episodes of abnormal electrical activity in the brain that lead to a wide range of symptoms and behaviours. Neurons in the brain communicate through electrical signals. Normally, there is a balance between excitatory and inhibitory signals that maintain stable neuronal activity. In seizures, this balance is disrupted, leading to increased neuronal excitability. Seizures often involve the synchronized firing of large groups of neurons. This synchronization occurs in different regions of the brain, leading to different types of seizures and various clinical manifestations. Seizures typically have two distinct phases. In the ictal phase, the active phase of a seizure, abnormal electrical activity occurs. Symptoms during this phase can vary wildly, from mild sensory changes to loss of consciousness and convulsions. The post-ictal phase comes after the ictal phase, and there is a period of altered consciousness and neurological symptoms. This phase often includes confusion, weakness, fatigue, and memory impairment. Now, seizures can be broadly categorized into two main groups. These are generalized seizures and focal or partial seizures. Generalized seizures involve both hemispheres of the brain and often result in a loss of consciousness. Focal seizures, on the other hand, originate in a specific area of the brain and may or may not involve loss of consciousness depending on the type. Because yes, even in these two types there are subcategories of seizures that we're going to cover now. Now, how many different types of seizures there are does seem to differ based on what resources one is looking at. It's important to note the date of this video's creation if you're looking at it in the future to keep up to date with the leading research and information on the topic. For the purpose of this video, I am going to cover the 7 as described by Johns Hopkins Medicine. These are absence, atonic, tonic, clonic, tonic-clonic, myoclonic, and febrile seizures. Absence seizures were once known as petit mal seizures. They primarily affect children and are characterized by a brief lapse in consciousness. These involve staring spells that start suddenly and may be mistaken for simple daydreaming. The person having an absence seizure will typically stop moving and stare in one direction for 15 seconds or less. Fortunately, the episodes resolve on their own, and though the person may not remember what happened during the seizure, their normal state of alertness returns immediately afterwards. Atonic seizures involve a sudden loss of muscle tone, which can lead to a person dropping or collapsing. Hence, they are often referred to as drop attacks. A seizure of this type involves a sudden decrease in muscle tone, causing a person's body to go limp, slump, or collapse completely, possibly resulting in injury. Atonic seizures characterize certain epilepsy syndromes, such as Lennox-Gastaut syndrome. This is a severe form of epilepsy, a syndrome characterized by an individual that has multiple types of seizures. This usually begins before the age of 4. Tonic seizures cause sudden and sustained muscle stiffening, which can often lead to falls. In a tonic seizure, the person's muscles stiffen and they lose consciousness. The eyes roll back in their head and the muscles of the chest, arms, and legs stiffen, causing the back to arch. The contracting muscles in the chest make it hard to breathe, and the person's lips and face may turn grey or blue. It is quite common for the person to make gurgling sounds while struggling to breathe. Clonic seizures cause a person's muscles to spasm and jerk. Muscles in the elbows, legs, and neck flex and then relax in rapid succession. The jerking motion slows down as the seizure subsides and finally stops altogether. As the jerking stops, it is common for the person to let out a deep sigh before resuming normal breathing. Tonic-Clonic seizures, formerly known as grand mal seizures, are one of the most widely recognized and dramatic types of epileptic seizure. It is perhaps the one most people refer to when thinking of seizures due to their severity. As the name implies, this type of seizure involves features from both tonic and clonic seizures. A tonic-clonic seizure typically progresses through both phases. Initially, there is the tonic phase, where there is a sudden loss of consciousness and the muscles in the body become stiff and rigid. After this, the seizure transitions into the clonic phase. At this point, the person experiences rapid, rhythmic and jerking muscle movements which typically involve the arms and legs. These movements can be quite violent and may last for several minutes. Myoclonic seizures are characterized by sudden body jolts or increases in muscle tone as if the person had been jolted with electricity. A myoclonic seizure is similar to the single or multiple sudden jerks people sometimes experience as they are falling asleep. Sleep myoclonic jerks are benign, whereas myoclonic seizures can be harmful since the jolts occur in bouts. Finally, we have febrile seizures, which typically occur in young children between the ages of 6 months and 5 years. These seizures are associated with a fever, often caused by a common childhood illness, such as an infection or viral illness. Febrile seizures are relatively common and usually occur when a child's body temperature rises rapidly. They affect the whole body, and a child may experience symptoms such as muscle stiffening, twitching, and a loss of consciousness. Now, when it comes to focal seizures, there are 3 separate types to think about. These are simple focal seizures, complex focal seizures, and focal to bilateral tonic-clonic seizures. Simple focal seizures, previously known as simple partial seizures, originate in a specific area of the brain and do not impair consciousness. Now again, according to Johns Hopkins Medicine, physicians will typically break down these simple focal seizures into the following 4 areas, depending on the location in the brain and parts of the body affected. A motor focal seizure will, as the name implies, affect motor symptoms, typically resulting in muscle activity, causing jerking movements of a foot, the face, an arm, or another part of the body. Physicians can typically diagnose which side of the brain is affected by observing which side of the body experiences symptoms, since the left brain controls the right side of the body and the right brain controls the left side of the body. Sensory seizures cause sensory symptoms, which leads to hearing problems, hallucinations, olfactory issues, and other distortions. Autonomic seizures affects the part of the brain responsible for involuntary functions. These seizures may cause changes in blood pressure, heart rhythm, or bowel and bladder function. Psychic seizures strike parts of the brain that trigger emotions or memories of previous experiences. These cause feelings of fear, anxiety, or déjà vu. Complex focal seizures are often preceded by a simple focal seizure, also sometimes referred to as an aura. Patients experiencing a complex focal seizure may stare blankly into space or experience automatisms. These are non-purposeful, repetitive movements such as lip smacking, blinking, grunting, gulping. These were previously referred to as complex partial seizures, although the name has dropped. They start in a specific area of the brain, but unlike simple focal seizures, can impair consciousness and awareness. Finally, we have focal to bilateral tonic-clonic seizures. These have also sometimes been referred to as focal to bilateral convulsive seizures, and are a specific type of seizure that initially begins as a focal or partial seizure and then progresses to involve both hemispheres of the brain, leading to a generalized tonic-clonic seizure. Though witnessing a seizure can be frightening, it is a myth that a person having a seizure is in danger of swallowing their tongue. This is not anatomically possible, so never put anything in the mouth or forcefully open a tightly clenched jaw while the seizure is happening, as this could harm the person. A seizure typically lasts a few minutes or less, after which the person is likely to remain unconscious for a few minutes more, depending on the intensity of the seizure. In this post-seizure period, and during this phase, the person's brain is extremely active as it tries to control the abnormal electrical impulses and bring the seizure under control. People regaining consciousness after a seizure are likely to be sore, confused, frightened, and very tired. It's vital that you provide assurance and support, as it's the best help an observer can offer. This has just been a very quick rundown of the different types of seizures that are present. If you would like to learn more, I will put all of my references in the description below. For now, however, thank you very much for watching.